can you do quick audio checks for me?
Yep, David Lynde with American Medical Response.
Perfect. Okay. And we are good on the end. There's there. Okay. So let's start with call volume and trends. How often are you responding to fentanyl-related overdose calls?
Well, certainly daily, multiple times daily, probably averaging 12 a day.
And then are you seeing more deaths, or are you seeing more cases of administering Narcan and they're either transported to the hospital? Which are you seeing more of, or is it kind of like even?
Well, I don't know that we noticed that so much. I mean, certainly Narcan administration by the public is up over the last year, but I don't know that I have any information for you really on deaths or anything like that.
Right. I know that the city and the state monitor deaths, but they don't really monitor those who are surviving through Narcan and things like that. I just wondered if that kind of is changing. Or
There's no good way to monitor it.
Right.
Because most people that get woke up from Narcan, a lot of them simply go on their way. So they don't necessarily go to the hospital or seek treatment or anything like that. They just go on their way.
Right. And their life is saved.
Yeah, for sure.
And over the years, have you seen an increase in overdose calls?
Oh,
Let's
certainly.
look at this past year. Let's look at 3 years ago.
Yeah, there certainly is an increase in overdose calls, and the potency of the drug. That you're seeing multiple doses being given, versus years back. It was one dose for sure, but now people are getting 2 and 3 doses.
And are you seeing that it's straight fentanyl or kind of that mix or both?
So we officially never know. We kind of hear after the fact, if it's carfentanil or what's mixed, but specifically we don't know unless they tell us.
Right. You kind of.
We just know it's an opioid, which works with Narcan and things, but yeah, we don't necessarily know the mixture.
So you said about on average 12 a day. A year ago today, or even 3 years before that, what were the average calls you would say?
I don't have a solid number. We've
Right.
had some deployment change stuff that has really affected for me to know that specifically.
But would you say it's lower?
Today it's not lower. It's definitely higher.
Or no, like a year ago today and 5 years ago today.
Oh, definitely lower. Yeah.
Okay.
5 years ago we were probably going on heroin overdoses, and now nobody uses heroin, or we don't see heroin, I should say, because the price difference. Fentanyl's so cheap in comparison. So
why do you believe that? Actually, I should word it this way: do you believe that fentanyl is a crisis in Yakima County?
Oh, definitely.
And then why?
Just it's cheap, readily available. It's everywhere.
And then, are these overdoses typically isolated incidents, or do you often respond to multiple in the same area?
Well, I'd say isolated, but it's not uncommon to go to a place with multiple. Nobody would be surprised if they got there and there was multiple, but mostly isolated instances.
Okay. And what age groups are you seeing that are most affected?
It hits everywhere.
Okay.
It doesn't. I would say the teenage years all the way through geriatric years. There's not one category that stands out.
And there was another thing that because I reached out to a drug prevention effort counselor, and I was meaning to ask you, and I probably should have added it to the questions. When it comes to responding to the calls of a possible overdose, are you finding that it's in the community among the homeless population more, or residentially?
I gotta say, I just think it's a mix. I mean, it's not just in one section of Yakima County. We go to these calls everywhere in Yakima County. So yeah, I would say it's like a mix. I don't know to put specific numbers, but it's not. We don't find it always in downtown Yakima or always in the homeless camps or stuff like that. We're going to houses, businesses, and everywhere in Yakima County.
And I'm glad you said that, because a lot of the public, a lot of the community continue to put it on the homeless population that they're the reason why our law enforcement, our first responders are doing this, because of the homeless population.
Oh yeah, no, it's definitely throughout Yakima County.
A mix, yeah. And what does a typical fentanyl overdose call look like when you arrive? As much as you can kind of tell me.
Basically they're not breathing. I mean, that's what, they just have so much fentanyl in their system that it represses their respiratory drive, and so yeah, most times folks are not breathing, or and that's why they've called 911. Today, more and more, you're seeing a lot of Narcan out there, a lot of people administering, so folks could be coming down, but kind of the telltale sign is, not breathing.
And what's AMR's stance on Narcan? I know it's administered, and the only reason I ask what the stance on it is because we're going back to the public. There's a mix of people who believe Narcan is great, it's saving lives, but then there's the other side of things. Narcan is just allowing them to get back out there and use again.
Well, so we use Narcan, it's in our protocols, and so we use Narcan to, save their life, to counteract the drugs. We're participating in a statewide Narcan Leave Behind program. I have Narcan on all my ambulances that, when we go to these scenes that we offer folks, so they have the ability to, have Narcan close by. We don't have it as like a specific stance. I mean, the drug works, it does exactly what we want it to do, and it does help save their lives, and I think unfortunately for the county and everywhere else, it's like the only tool available right now. There's no, there's not enough help out there otherwise to address the issue, and so while Narcan may not be the greatest fix, it is a fix. It's the tool we have today. Does everyone hope something else comes along? I think absolutely, but it's the best tool we have in our toolbox today.
Yeah, I feel like it's as much as it's administered, it's also saving lives. That
100% works.
It could be higher without Narcan.
Yeah, no, it 100% works. So, for sure.
And then, are people using alone, or are you finding groups of users when you're responding?
I don't have a solid answer there. I think, I think it's both. There's times where, it's just one person, and somebody's found them, or, definitely time where, they've called in, right away because it could have been a group of folks. You don't specifically know, you don't specifically know most times, because most people will kind of, they'll call and then they'll disappear. So somebody might call in, but they might not wait around because they could have, assumption is, they could have been doing the same thing and they just don't want to be associated, but they, want their friend to be saved. So I don't know. There's any solid information I could provide.
To jump off of that, do you believe that the community has some type of hand in helping with the crisis in Yakima County?
Well, I don't know that answer. I mean, I think people do what they can. I mean, we have folks that are, that are taking part in the Narcan administration program. There's several vending machines in Yakima County. There's restaurants and other businesses that are, that have the drug, or they have Narcan boxes out there, for folks to get that. But that's, that's what I know. I don't know much else, I know there's organizations that are working very hard, you know, in areas outside of EMS, that want to, you know, help with the issue.
And do you, is one dose of Narcan usually enough? Like, how often is it being used?
Yeah, one dose, we usually don't see one dose anymore. You know, usually it's 2 doses. Some of it has to be, you know, with Narcan out in the public, you know, folks are delivering Narcan and they're not instantly turning around and they're hurrying up and delivering their second Narcan. Where, you know, if they probably wait 3 to 5 minutes, because it does take Narcan a bit of time to work, you know, but when you're watching somebody not breathing for 3 to 5 minutes, that's not a good thing, you know. And so I think, you know, they don't necessarily have the ability to breathe for them, like EMS services do. And so, you know, sometimes I don't know that they necessarily need the second dose, but we're definitely seeing some stronger and stronger drugs out there where second doses are being given, and even third doses. You know, it just depends on how much they did and, you know, where their system's at, tolerance levels, stuff like that.
And like you said, the potency.
Yep.
And are you? No, I think I'll probably skip over that one. Are overdose patients getting follow-up care, if you know, after being reviewed?
Specifically, I don't know. I believe that if they want the care, it's out there. Everyone doesn't want the care. I think we talked about this earlier, but, you know, many times they won't even allow us to transport them. We have, you know, we or someone else at the scene has administered the drugs, and, you know, through conversations, you know, they're just no longer interested in anyone helping them out.
And yeah, because that's what I was going to ask. Like, kind of when you arrive to the scene, you see someone's not breathing, you administer the Narcan. Are you transporting them? But like you said,
yeah, no, you know, they once they become awake, you know, there is, you know, they have the right to make up their own mind. They're not required to transport. They're not required to go to the hospital. You know, and actually, we try to encourage them, because, you know, Narcan only lasts, you know, 30 to 90 minutes, kind of, and, you know, depending on how much stuff is in your system, you know, the effects could wear off. So you always encourage them to, you know, be seen, but, you know, many times they don't. They just simply walk away.
Do you, and this might not be a question you can answer, but do you think it's simply because, like, in the back of their mind, they're thinking about the cost of being transported? Because I know even with a lot of people who aren't even, say we're not on drugs, and I called because I cut my hand open or badly or something, a lot of people also have that pre-notion or that fear, I'm just going to drive myself to the hospital because it's so expensive to be transported.
Yeah, I have no way of knowing that. You know, I think a lot of it has to do with, you know, with lifestyles and choices they make, but that's, I don't know that they think about costs. I mean, yes, I know folks think about costs of those things, but I think for them it's, you know, it's just going to be their personal decision.
And they're like, I got my Narcan, so.
Right. I mean, some of them bank on it, you know, certainly.
And are there situations where even Narcan doesn't work?
Well, yeah, I mean, so time down, you know, if someone, Narcan doesn't always work. It works, however, it could be too far in the process, I should say. So Narcan always works, but, you know, if you're too far along in the process of not breathing, Narcan's not going to help. You know, you're going to go into cardiac arrest and without breathing.
And I know this probably varies within each individual, but how long do you kind of like have to be out for Narcan not to work? If you know.
Yeah, I don't know.
You don't know. It depends on like the.
Yeah, I mean, you know, every time you're not breathing, you know, and you go into cardiac arrest, you know, that's time is of the essence.
Right.
You know, and so yeah, I would not have a good answer there.
What are the biggest challenges your crews are facing during these overdose responses, if any?
You know, I just have to think their challenge is, you know, they're out here to help people, you know, and sometimes they don't want the help. After you've delivered the Narcan and they come back around, they simply don't want the help. And so that's probably the biggest wear on folks in the field is folks simply not wanting the help.
And do you feel like you have enough resources and training to handle the volume of fentanyl cases?
I believe so. It's part of the 911 system, and we're well staffed to serve the 911 system. And then, training is we work on that all the time through OTEP programs and stuff like that. And so I don't want to tell you it's simple, because obviously there's a lot of training going in there. But this is stuff guys are doing every day. So,
do you feel like there could be more that AMR does? Like, is there always room for more? To do more?
Yeah, I don't know that there really is. We're doing all we can. We're trying to get them to definitive care. Having the real conversations with them about getting to the hospital. Encouraging them to go, even if they don't want to go with us. As we work through a refusal process, part of that is just advising them, like, this is a bad situation you're in and you could die, so please go to the hospital, So it's not mandatory they go with us, but, they have friends and family as well, so.
And do you believe that, or is this crisis affecting mental health or morale of teams? Is it making the team stronger? Is it affecting them? Okay, we're seeing all these people, but they don't want to be saved.
Yeah, I think it does wear, morale wise. I think it does wear when you're doing your best, and it's you're doing your best, and it's simply not. They're here to help people, and when people don't want their help, I think that that kind of wears on you.
And has fentanyl changed the way you approach emergency calls? Probably not, but
no,
I
mean you start them all exactly the same, so I wouldn't. No real changes there.
Okay. And what concerns you most about where this crisis is headed?
Just the lack of solutions, and I won't say that there's not solutions out there, but there's funding is always something you have to consider, and how do you do that? I mean, I know that there's probably 1,000 pieces to the puzzle here to try to advance any real form, but you just worry about it getting worse. We are seeing obviously stronger variants because you're giving more drugs. You're with call volumes being up, fentanyl related or drug overdose related call volumes being up. You don't see an end in sight. I see, like the Narcan leave behind programs. You see, there's certainly a lot of education out there. There's, all of those measures in place. But I know we have to do more, but I don't have the answer to tell you what that is.
Right. And there's so many agencies involved in this. Oh
yeah, I mean, everyone, there are always, different stats. I mean, even Washington State, they're proactive. They're publishing data. You said you'd seen that data every month, by our region. You can go on there, and they even have a website designed to tell you where you can get Narcan, and so everyone's, kind of doing the things that they can. But a lot of it's probably mental health, treatment related, and we all know there's just not enough resources out there.
And I feel like COVID's also a factor, even though we're a few years past it, it's still probably a factor.
Yeah, it set everything back a couple years, everything. So there's definitely that.
A lot of people, I mean, maybe they didn't turn to drugs, but a lot of people have mental health issues. A lot of people went out to buy emotional support animals. It was just a time where everyone was experiencing the same thing all over the world.
Yeah, that's for sure.
Are you starting to see more cases involving carfentanil or even other stronger opioids, if you know?
Yeah, we don't specifically don't know the drugs. I mean, yes, you can, get some indication of the potency of the drug based on how you're waking them up, with Narcan, but we kind of hear that stuff after. Right. It seems like it comes in phases, like, when I'll say a new batch comes into town, you kind of see the overdoses pick up, and then it kind of stabilizes, I would say, to where you're, just seeing, a few calls a day. But it seems like when the new batches come in town, like the latest one, again, carfentanyl's getting a lot more popular, or that trank, they're, you're seeing those come in, and definitely see more overdoses as that come. But nothing we have no specific knowledge kind of until after the fact through, I would just say, conversations at meetings and such.
Right. I know that there's like an alert that usually goes out, that it's like a spike alert. Does AMR receive those as well? Like, are they?
I don't think so.
Okay. Because I know they
have some hotspot maps and stuff. Yes, I'm aware of all that stuff. But again, it doesn't really change. It doesn't really change our focus, I guess, or what we do in running the calls, because they all start out exactly the same. So.
Right. And another question I had about kind of the way Washington State kind of operates. They document overdose deaths, but not people who survive, even when Narcan's administered. Is it required of AMR to, of course, document the death as an overdose?
So we document every call we go on,
right?
And so yes, if we're on a call and there's an obvious death and stuff, our report would reflect that. But I think the documentation, a lot of the death documentation, relies with the coroner's office. We report our data through WMSIS, and so they get all of the information that we put in their charts, and that's where a lot of that's driven. But I don't think we're not officially say there's a death,
Okay. And what kind of support or changes would help AMR? I know that you mentioned like you're doing all that you can. You kind of don't almost like need the extra support, but what kind of support or changes would help AMR on the call side of things and on your team side of things? Because like you said, as you continue to be in the field as a first responder, it will wear you down, whether it's opioids, whether it's responding to murders or anything like that.
Employee support, we have lots of avenues for that, if things are bothering employees, and so we have lots of avenues available to our employees. As far as dealing with the drug itself, the only real way to solve it is to end it. And like I said, we all agree that there's plenty of people working on that, but there's no end in sight, and so like I said, just we provide resources to our employees. We continue to train. We there's some currently in Washington State, there some pilot programs going on for buprenorphine, and so I know that the county's talking about maybe entering something like that. Again, it's just another tool in the toolbox, to help people that want help.
And not to make things political, because I hate politics, but do you believe that you're seeing less drug-related cases because the border's closed?
Well, no, but we're seeing more drug-related cases.
Okay, because I interviewed with Marshall last week, and compared to last year, the deaths are lower compared to last year.
Yeah, but I bet if you look at the Narcan distribution programs that are popping up, Narcan is literally everywhere,
right?
And so I have no official knowledge of this, but I bet it's just because Narcan's out there. When we, it seems less and less times we get on scene and the patient has not been given Narcan, and now, I say that as EMS, AMR for sure, but EMS, because there's home Narcan, there's, we're literally leaving it with people on scene. When we're on scene, we have people coming up to us, and asking if they can have some Narcan. And so, I know that there's other fire departments in the valley that take part in that program. Like I said, I know we have some vending machines out there, restaurants and things, and so I think the availability of Narcan is probably what's leading to that, but I have no official knowledge to support that.
It's interesting that you say that, because I almost don't know if that's a good thing or a bad thing.
Yeah,
It's a double-edged
I
sword.
tend to agree with you. You know, like I said, it's not the best tool, but it's our only tool in the toolbox right now. You know, and so, you know, and so yeah, I understand the pros versus cons of, you know,
Right.
folks' opinions, and I can agree with both of the opinions. Not really. I mean, that's the reality of it. But yeah, Narcan, it's a pretty safe drug. I mean, you know, to help treat it, and it does work. And most anyone, you know, mostly what we give out is nasal, but we do give out some injectables as well.
It just makes me question, wonder how we got here. I feel like, I mean, of course I'm from the East Coast, but coming here I didn't realize it was just so common to hand out Narcan like candy. Not that I'm against Narcan.
Yeah,
It just seems like there's just like this shift.
Well,
Last
and that's,
few
you know,
years.
handing Narcan out. I want to say like 2022, the state put some things in place that allowed Narcan to be obtained without a prescription. I think it was in 22. You know, and that kind of paved the way, and obviously that's when they're starting to see, you know, deaths go up, probably related, you know, the assumption, I guess, is related to COVID, and, you know, folks being by themselves, and, you know, all the stresses and everything else that went along with COVID, you know. And then I just think that, you know, the programs have found some grant dollars and other things, you know, it's easy to say you want to give out Narcan, but Narcan's expensive, you know, to give out, and you know, our participation in the program is, you know, through a state grant, you know, where they provide the Narcan, and we have to ask, I believe it's 3 questions that we ask every person that we give it to, and they're not identifying questions. They're, you know, basically, you know, how was your last dose of Narcan used in a save? Have you ever used it before, and do you need any training?
Can someone like fail that test?
No. We just have to ask the questions, and they answer the questions. You know, the one thing that we like to do is ensure they know how to use it. But, you know, our packages have instructions on them too. So, you know, if they don't want to, you know, spend a couple of minutes learning how to use it. But like I said, in today's atmosphere, you know, they're really coming up and asking for it. You know, so we are seeing people that have taken some time and know a bit about the drug.
It's as accessible as a teenager going on the web and ordering drugs.
Yeah, there's mail order programs out there too, so it's definitely everywhere.
Well, you're all set for me. Is there anything else that you'd like to add that I didn't ask you about or didn't cover?
Boy, I don't think so.
Okay.